despre viață vorbim în cele ce urmează, cu un medic emerit venit la București de peste hotare. E un inovator și, înainte de toate, e un om dincolo de halatul alb și serios pe care îl poartă zi de zi. Un dialog impresionant despre viața la limită, despre soluții pentru sănătate la nivel mondial, despre descoperiri și noutăți medicale ce ne dau speranță. I remember that when I tried to make a documentation for myself regarding you, I saw a very important information which I want you to tell me about. The single port closed lung surgery that you performed was selected as the most creative and instructive content of 2014 in United States of America.
As a thoracic surgeon, I have always dealing with the problem of lung cancer. So with those patients who are very ill condition. So as other thoracic surgeons in all over the world, we are trying to do our best for the patient because they are very ill. So we have to do surgery in these patients, in patients with lung cancer, in the minimal invasive way as possible. When you think about operation in patients with lung cancer, people always think that, okay, chest will be opened and the ribs will be broken and sometimes chest bone will be open. No, not anymore. So now we just putting a camera inside from 3 or 4 centimeter incision.
So just one incision?
Just one incision only, just putting a camera inside, and we are taking this, we are recording the view of the inside of the chest to the screen.
How small is the camera?
The camera is only 5 millimeter or 10 millimeter in diameter.
It's so performant that you see every detail.
Every detail, because you can move the camera inside wherever you want to go, so you can see better than open surgery. So you take the picture to the screen, so you can see the inside of the patient and the cancer on the screen, and you can operate when you looking at to the screen.
So you can take out the tumor,
yes,
just from this one single port.
That's correct. This is why it was elected one of the most creative and innovative surgeries in 2014 around the world.
How this kind of operation decrease the side effects regarding the patient, because I think this is the most important.
Yes, because patients are always coming to our office asking the minimal invasive procedure. Nobody is coming to my room that I want to be operated in open fashion, because patients now have so many sources of information like internet and books and magazines, so they know that if surgery is something like this, so this is good for them. Why? Because when compared to open surgery, which is very painful and which has some problems after surgery, as you have some problem of coughing and pain and walking and returning your back. So this diminishes your immunity. Immunity is the key point for lung cancer or all type of cancer. In less invasive surgery, like the single port thoracoscopic surgery without opening the chest, the immunity of the patient is high as possible.
And also the patient can go out of the hospital rapidly.
Median days of hospitalization is 3.5 days. So after surgery, one night stay in the intensive care unit, and then 2 nights in normal ward, and then 3 days later, so they are discharged and they're going home. So this allows,
which is unbelievable. The medicine evolved so much.
Yes, because patients' demand is everything. Because patient is asking less invasive surgery because they want to go normal life as early as possible, because they have to go work.
I have to say something very straight. In our country, when a patient receives this news, you have cancer, this is like equal with death. They are simply frightened about this possibility. And sometimes they cannot even think to the solutions. They don't know how to put the proper questions to the doctor. So, as you said, it's so important to receive the right information, to see your possibilities and your future. In order to be able to fight with your illness, you need to have a good attitude.
Yes, absolutely. So first of all, we have to understand and we have to know exactly that diagnosis of cancer is not equal to death. This is absolutely not correct, because we have to understand that now we are living in the era of cancer, because we have so many cancer types in our body. So we can't say that I don't want to hear the term of cancer. No, it is not possible, because we are living in the era of cancer.
Unfortunately.
Yeah, lung cancer is the #1 cancer type in all over the world. Breast cancer for women, and prostate cancer for men, also gastrointestinal cancer. So we shouldn't afraid of this, but we have to know all the details of this cancer. So cancer is not equal to death. There are so many treatment options for cancer. Okay, nobody can say that cancer can be cured 100%. This is not correct. But if you are diagnosed in earlier stages of disease, of cancer, it means that you have very high probability of treatment, for very high probability of cure.
You really arrived in a very important point. To know that you have the illness from earlier stages.
Yes.
So this means to go to the doctor at least once a year, to make a checkup.
If you go to checkup without having any symptom, any complaint, and incidentally you are diagnosed as a very, very small tumor, it means that you have maybe more than 90% chance of cure of this cancer. But if you go to the doctor with significant weight loss and pain and with other problems, it means that the cancer, cancer disseminated to all over the body, and you are now late for the treatment. But even in that case, we should keep our mind that there are still treatment options that prolong life. So I strongly advise that please do not think that if you have a cancer, it doesn't mean that this is the end of the road and you will die immediately. No.
Just remain rational, logic, and try to find as much information as you can.
Absolutely, that's correct.
This is really amazing, to be able to come back to your life, even if you are not so young, so your body is not so strong to fight against cancer. But when your surgery is a success, you simply can live a good life, a long life, nearby your family, nearby your kids. So there is a hope.
That is absolutely correct.
You just came from Istanbul, where you work, and you have right now there a very young patient. It's called Cristian Filip. He's Romanian. He's staying there from more than 6 months already.
I operated him on 6th of October last year. I remember him. I know him very well. 6 months ago, I saw this young boy in my office.
He's 15 years old now.
Yeah, yes, 15 years old.
And many people helped him. They know him because the case became well known in our media. They try to make donations, so that's why we follow this case.
Yeah. So he came with his family to my office with a very, very big tumor in his right chest. This was the tumor of the rib cage, the rib tumor, which is very, aggressive. We call it aggressive tumor. The tumor was in the right side, and it was 25 centimeter tumor. And tumor was not only invading the rib, but also invading the lung. So I operated Christian to remove the tumor from the rib, also from the lung. And after 5 years, now we see his contrast tomography. Everything is okay. We don't see any problem at all. But his chemotherapy to protect the body for dissemination of the primary tumor. So we have to give chemotherapy to him, and it takes 1 year after surgery.
Într-adevăr a venit fără șansă, fără speranță din România. Vreau să vă spun că a fost o intervenție foarte grea, foarte complexă, dar datorită domnului profesor Dr. Semih Halezeroglu, intervenția a fost un succes și i-a acordat lui Cristian o șansă mare la viață.
The second most important thing in my life, of course, after my family, my job first, and the second is my hobby, which is motorcycling. And I live always with this hobby. It is always in my mind.
You need adrenaline also in your personal life.
Yeah, well, it is the best way to see all over the world. It is the best way to have friendship. It is the best way to know you. It is the best way to understand the value of life. Because when you are in a danger in motorcycling, so you think that, okay, this is the end of the road, I think, and you are starting in this very tiny period of time, you thinking that life is beautiful. But when you save your life at that point, and then you start to love the life much more than before. So,
where did you travel around the world with your hobby?
Yeah, I went to Africa, in South Africa, Republic of South Africa, Mozambique, Swaziland, and I also went to Himalayas, India, Nepal and Bhutan. I also went to South America.
What is the advice you give to a patient when he finishes his treatment in your hospital?
There is nothing comparable with the moment that you are saying to your patients who are treated appropriately, goodbye, okay. I don't think that there is nothing comparable in the world better than this point.
It is a reward, in fact, for you.
Yeah, absolutely.
Există o multitudine de aspecte ale vieții din care încă mai avem de învățat. De aceea, aici, la Pretuieste Viața, vom vorbi și data viitoare despre schimbarea în bine ce stă în puterea noastră, la orice vârstă. Fie că suntem la început de drum sau suntem părinți ce vor să le insufle copiilor lor valori pe care să se poată baza în viitor. Fie că suntem tineri la 40 de ani, din ce în ce mai tineri la 50, 60, 70 și mult mai departe. Cum să trăiești frumos și demn la orice vârstă? Cum să dai sens cuvântului longevitate? Cum să faci parte din viața ta și sănătatea, și sportul, și frumusețea, și bunele relații cu cei dragi? Cum să cultivi frumosul și să crești mereu la nivel personal? Despre toate acestea, pas cu pas, putem învăța împreună, puțin câte puțin. Rupe lanțul tiparelor din viața ta. care te țin pe loc sau te trag înapoi și îți promit că nu vei regreta nicio clipă schimbarea ce te face să te simți în sfârșit în trupul și în mintea ta din nou acasă. Iar dacă într-o duminică la ora 17 nu reușești să fii în fața micului ecran, te aștept și miercuri seara de la 19 cu inima deschisă. Ne vezi de departe? Caută-ne pe TVR Moldova sau TVR Internațional. Îți e mai la îndemână internetul? Tastează tvrplus.ro și caută acolo Prețuiește Viața. Pe Facebook e de ajuns doar să scrii Prețuiește Viața la TVR. Mulțumesc DLS Catering, ne revedem în scurt timp, până atunci păstrează în suflet copilul din tine. Un gând bun și sănătate, că e mai bună decât toate.